There's a danger no matter where you go. And there are basically three things that a prospective recipient would want to know, three or four things actually, before they put these devices in the body. The first thing they need to know is that once these gel-filled devices are inserted in the body, bacteria will colonize the inside and the outside of the device. Mm-hmm. When they do that, and by the way, Dow Corning themselves, one of the recipients of the class action lawsuit, showed as early as 1999, I should say, or the year 2000, they showed that bacteria have the capacity to break down these molecules into smaller subunits that will then bleed through the envelope or shell because they become smaller than the pore size or envelope of the shell. So they need to know that. Number two, they need to know that once they do that, they can also go through a fibrous capsule that encompasses and encircles the device, the implant device, and it's been shown that they will disseminate and distribute to very distal parts of the body. And we've already talked about what some of those can do in terms of crossing the blood-brain barrier and things like that.
Yes.
And they also need to know that nothing lasts forever. So the rupture rate of the implants by the year 2000, which is 25 years ago, was already shown to be 5% per year. And that hasn't changed. That's exactly the same.
Interesting.
So that all that incorporates itself into what we call informed consent.
Yes.
Something solely lacking to the average person who's thinking about putting these devices in their body.
So you're advising women who are going to get augmented breasts and buttocks to go through informed consent. I dare say that probably in Latin America or in Central America, informed consent doesn't exist. I mean, I don't know. And I apologize to all of our Latino colleagues in South America and Central America who probably do, some of you do use informed consent. But by and large, it's unlikely.
It's highly unlikely, and it's actually pretty infrequent that it occurs.